The purpose of this presentation is to provide information on Iowa's Title V Maternal and Child Health Program in hopes that you will learn about Iowa's structure, who the agencies in Iowa are that implement the program, where the agencies are located, what supports and services they offer that benefit children and families, and how the agencies contribute to the early access system. The presentation is titled Title V Maternal and Child Health. However, I will only provide in-depth information on the child health part of the program. The intended audience for this presentation is those who work with children and families in early access. Before I provide detailed information on the child health program, I want to provide a quick overview on the Iowa Department of Public Health, also referred to as IDPH throughout this presentation. The vision the department has for Iowa is healthy Iowans and healthy communities. The mission of the department is protecting and improving the health of Iowans. Public health is a partnership of local public health, the Iowa Department of Public Health, nonprofit organizations, healthcare providers, policymakers, businesses, and many others working together to promote and protect the health of Iowans. Public health strives to improve the quality of life for all Iowans by assuring access to quality population-based health services related to the following goals: promoting healthy living, preventing injuries and violence, strengthening the health infrastructure, protecting against environmental hazards, preventing epidemics and the spread of disease, and preparing for, responding to, and recovering from emergencies. IDPH provides a variety of direct services such as licensing health professionals, regulating emergency medical services and substance abuse treatment providers, and collecting birth, death, and marriage records. IDPH is organized into 7 units or divisions. Under each division, there are several bureaus, and within the bureaus are several programs. IDPH has over 80 programs within the department. The Title V Child Health Program is one of those programs. The Title V Child Health Program falls under the Bureau of Family Health and the Division of Health Promotion and Chronic Disease Prevention. What is Title V Maternal and Child Health, also referred to as MCH, and why do we call it Title V? We call it Title V MCH because Iowa receives federal funds from the Title V Maternal and Child Health Block Grant Program. The MCH Block Grant is one of the largest federal block grant programs and is a key source of support for promoting and improving the health and well-being of mothers, children, including children with special health needs, and their families. The block grant is a federal-state partnership. States and jurisdictions must match every $4 of federal Title V money with at least $3 of state money. The block grant requires that states and jurisdictions conduct a needs assessment every 5 years. Based on the needs assessment, states identify the types of programs and activities they plan to implement to address the needs of their maternal and child health population. This gives states some flexibility, and because of this flexibility, MCH programs look different from state to state. States and jurisdictions are also required to submit annual reports on their performance. The annual report provides the opportunity for states and jurisdictions to document their progress towards the achievement of established performance targets, ensure accountability for the ongoing monitoring of health status in women and children, and lend support to the delivery of an effective public health system for the nation's MCH population. In Iowa, IDPH applies for the block grant and receives the federal funds. IDPH gives a portion of the Title V dollars to Child Health Specialty Clinics. Child Health Specialty Clinics is Iowa's Title V provider for children and youth with special health care needs. The remainder of the federal funds are distributed to the local level every 5 years through a competitive process. Agencies apply to receive funds, and they apply to serve certain counties. The department needs to have all 99 counties covered. In 2019, IDPH contracts with 23 agencies that serve all 99 counties. One agency serves one county, and the largest service area is made up of 15 counties. The department contracts with a variety of agencies such as local public health agencies, community action organizations, and private nonprofits. The agencies that apply often provide other services to children and families, and the Child Health Program is an additional program offered because it fits with their agency mission and vision. For example, one agency is a community action agency. They also offer Early Head Start, and provide the Women, Infant, and Children program, known as WIC. Each agency that has the Title V Child Health Program commonly refers to it as the Care for Kids program. The picture on this slide is a map showing the counties that make up the service areas for the 23 agencies that the department contracted with in 2019. Keep in mind every 5 years there is a potential for new agencies, and therefore service areas may change. The best way to find out what agency is currently providing the child health program in your county is on the department's website, http://idph.iowa.gov. In the search box on the homepage, type locations. One of the first search results will be Bureau of Family Health locations. Click on this. You will be taken to a web page that contains PDF maps for child health, maternal health, and family planning services. This is updated if and when agencies and/or service areas change. Iowa's Child Health Program serves a large number of infants through our newborn hearing screening and dried blood spot program. We also serve thousands of children and adolescents, including those with special healthcare needs. On this screen, there are the unduplicated counts of children served for FY14, FY15, and FY16. This information was taken from IDPH program profiles. In FY 2014, Title V served 38,718 infants under 1 year, 500,000 children 1 to 22 years of age, and 6,749 children and youth with special healthcare needs. In FY15, Title V served 39,502 infants, 204,625 children, and 7,811 children and youth with special healthcare needs. In FY 2016, Title V served 38,570 infants, 166,041 children, and 8,240 children and youth with special healthcare needs. Considering Title V MCH has statewide reach and connects with thousands of families with children, it is worth early access developing relationships with their local agency. Let's take a closer look at 2 Title V child health agencies. The first one we will look at is a local public health agency, Webster County Public Health. Webster County Public Health serves 15 counties in northwest, north-central Iowa. In addition to offering the child health program, Webster County also offers the following. I am not going to discuss each service that is listed on this slide. I'm just going to go in depth on a couple of the services. One service that they offer is the Breast and Cervical Cancer Early Detection Program. And this program enrolls women and supports them in obtaining annual exams such as mammograms, clinical breast exams, and pap smears. The program targets women age 50 and over, but has enrolled younger women that are symptomatic with breast problems. This program is a great relief for lower to middle income families, especially those without insurance. It allows women to receive annual exams without the financial burden of out-of-pocket expenses. Since it is only a screening program, not all diagnostic tests are covered. Webster County also offers a maternal health program. This program serves pregnant women and provides health information, resource and referral information, linking them to services. They help pregnant women find a doctor or find newborn care once the child's born. And after delivery, they provide a home visit. They also offer the WIC program. WIC provides healthy foods, healthcare referrals, breastfeeding support, eating tips for pregnant women and their children. WIC is for infants, children up to age 5, pregnant women, and breastfeeding women who had a baby in the last 12 months, and a woman who has had a baby in the last 6 months. Now let's take a look at another Title V agency that is a community action organization. Matura covers 3 counties in southern Iowa. In addition to the Child Health Program, Matura provides a variety of programming that may be beneficial to families. This screen lists several of the programs that they offer that might be of benefit to families. I'm only going to go in depth on a couple of those, and that is the energy crisis intervention services that are available. They can offer some support for furnace repair and replacement, blankets, heaters, medically necessary air conditioning. They have emergency shelter and food, so they assist families who are facing a crisis situation with food, shelter, and utilities. They try to prevent homelessness, and so they can assist families who are facing eviction or utility disconnection. They can also assist homeless families with emergency motel stays and try to assist them in securing temporary or permanent housing. They also have the LIHEAP, known as the Low Income Home Energy Assistance Program. And this is designed to aid low-income individuals in the payment of a portion of their residential heating costs for the winter season. Now that we've reviewed other types of services an agency might provide in addition to child health, let's review what some of the child health required services or activities are. I have not listed all of them on this slide, and I won't review them all. I've just listed ones that I think would be a benefit for those of you working with children and families. I believe that a few of these services that child health agencies provide are especially valuable to those who are providing service coordination. Child health agencies are responsible for providing informing services for families of newly Medicaid enrolled children and adolescents. Informing is the act of advising families about the services available within the Care for Kids program. Informing services include an explanation of the benefits of and services within the Care for Kids program, with an emphasis on regular preventative health care, including oral health, an explanation to families of what services to expect when they take their child for a medical screening exam and dental exam, and education on the importance of establishing medical and dental homes. Child health agencies are a great resource of information about available health and community resources, such as transportation and how to obtain them. Several of the agencies have resource guides posted on their websites. If you work with children and families, you may find the resource guides helpful in your work. Assistance with Medicaid and Hawkeye applications is another service our agencies offer. If you work with families in need of health coverage and the family plans to apply for Medicaid or Hawkeye, contact a child health agency to assist. Child health agencies can assist individuals with applying and can provide presumptive eligibility services. Presumptive eligibility provides Medicaid coverage for a limited time while a formal Medicaid eligibility determination is being made by the Iowa Department of Human Services. The goal of the presumptive eligibility process is to offer immediate health care coverage to children and adolescents before there has been a full Medicaid determination. This allows for immediate access to services. iSmile is a statewide program that helps kids get dental care. If you have a family whose children need dental care but are having issues accessing care, the iSmile coordinator at the Child Health Agency can provide education, some oral health services, and work to help families establish dental care. The last few activities and services that I will review are the services and activities that link child health programs to the early access system. Child health agencies are required to promote early access, complete developmental screens, and provide developmental monitoring. The agencies use the Ages and Stages and the Ages and Stages Social Emotional Questionnaire when screening children. I will review each of these activities on the next few slides. Assisting the early access system and child find efforts is done by agencies. One way agencies assist in child find is by promoting early access within their service area. Agencies promote early access by displaying and sharing early access information All agencies have early access information on display in their offices. They also display information at local health fairs, back-to-school events, and county fairs in their community. They educate community partners on the importance of early identification by sharing early access developmental milestone information at local programs targeting families, such as pregnancy education groups, local child care providers, and home visitation programs. Several of the agencies link to early access on their agency website and Facebook pages. Another way agencies assist early access in ChildFind is providing developmental screens as a way to identify children potentially eligible for early access and make referrals to the early access system. The method in which child health agencies provide developmental screening varies based upon the services the agency provides. For example, some agencies have access to children through WIC clinics, child health clinics, lead testing clinics, immunization clinics, and/or oral health clinics. These agencies have access to children and are able to conduct hundreds of developmental screens each year. A few agencies don't have access to children through a clinical setting, but are able to discuss development over the phone with families during the informing call. These agencies might mail the questionnaire or complete it over the phone. While they may screen fewer children in a year, they are offering the service. One agency that mailed screens to clients had a 30% return rate of completed questionnaires. All agencies refer children to early access for developmental evaluation when the child scores in the Refer for Evaluation zone on the ASQ. For children who score in the Monitor zone, agencies will provide families informational materials and suggestions on activities they can do with their children to encourage development and will rescreen the child in a few months. Based on numbers reported in agency year-end reports, the Child Health Program provides thousands of screenings each year. Finding children who may need early intervention services is a priority for the agencies. Agencies are also expected to conduct developmental monitoring of infants and toddlers found not eligible for early access. Therefore, if a child is evaluated and found not eligible for early access, they can be referred to the Child Health Program for developmental monitoring. Instead of telling caregivers to call early access again if they have future concerns, those families can have someone monitor their child's development and provide developmental information to help them know if and when a concern arises. Contact the Child Health Agency in your county to make a plan for early access so that children who are found not eligible can be referred for developmental monitoring. Thank you for your time today. If you have any questions, feel free to contact me via email or by phone. My name is Megan Miller. I am the Early Access Liaison at the Department of Public Health.